So I am Dr. Ernestine Deonza, and I'm the Associate Dean for Law and Police Studies at York St. John University. So I research on shared parental leave and breastfeeding, but currently, of course, researching widely on breastfeeding and its wider benefits. For those of you who don't know, which although I feel like a lot of you already know now, so I worked on the documentary on breastfeeding titled Breastfeeding Not on the Agenda. There are a number of faces on the panel today who gratefully contributed to that documentary, so it will be very good to hear from them again. So the documentary was highlighting the benefits and the challenges of breastfeeding, not just to health, because that's what we tend to hear a lot, but also to work, to the environment, and also the economy, given that the rising cost of living is all that a lot of us talk about. So what the webinar series has been doing is it's been exploring the different aspects of breastfeeding, sharing knowledge, the benefits, the challenges, and most importantly, also highlighting the need for a change. So if you did miss the documentary in itself, the link should have been in the Eventbrite that you used to book. If not, if you didn't get it or you don't have it, you can drop me a message in the Q&A and I will send it through to you. The whole webinar series as well is all being recorded and made available via YouTube. So the documentary and the webinar series, they all sit in one channel on YouTube. So once you get the link to one, you've got the link to all of them. But today, I am so pleased to be welcoming Dr. Maria Herron, Dr. Noella Gormley, Adele Python, Sinead O'Kane, and Mary Jo Chanel, who will offer insights and experiences and recommendations about putting breastfeeding on the agenda in Northern Ireland. I don't know how many of you know, but we know that the UK has the lowest breastfeeding rate, one of the lowest breastfeeding rates in the world. Northern Ireland has one of the lowest breastfeeding rates in the UK. And I think most of our panelists, or all of our panelists, come from a particular district in Northern Ireland called Derry. Derry has the lowest breastfeeding rate in Northern Ireland. It will be very interesting to hear our panelists explore all of this. So each of our panelists will briefly introduce themselves and will talk to us about what motivates them to be involved in breastfeeding advocacy, what they personally are doing to change the picture in Northern Ireland, which obviously will also change the picture in the UK, and what they would like to see happen in Northern Ireland to ensure that families are more supported if they want to breastfeed. Really, really looking forward to this. Thank you all for being here. And what I'm going to do is I will pass it on to Dr. Maria Herron, who will then start, and then we'll just lead and she'll pass it on to the other panelists. But really excited to have you all here. Welcome. Maria, please.
Great. Thanks, Ernestine, for inviting us to speak at this webinar today about breastfeeding in Northern Ireland. The whole concept of the documentary and the webinars is so important, and we're really happy to support you with this initiative. Three of us are from Derry, and Adele, I'll tell you herself, she's from Fermanagh, and Mary Jo is based in Belfast, so we've got good representation here from across the north. I've been involved in the breastfeeding world for three main reasons. Firstly, when my eldest child was born almost 31 years ago, I appeared to be the first in my extended family to have breastfed in at least 2 generations. So over the years, I actually learned that some relatives had breastfed, but it was almost like a family secret. No one talked about it or celebrated it. Fortunately, I grew up in Zambia as a child where breastfeeding was normalized. So I always knew that I would like to breastfeed my own children. Secondly, in the last 30 years, since my eldest was born, the breastfeeding initiation rates in Northern Ireland have either been fairly static or increasing slightly. For example, in the past 10 years, there's been an increase from 45% to 50% of any breastfeeding at discharge from hospital or from home births. A more significant and hopeful figure is actually the proportion of mothers who are still breastfeeding at 12 months. And this figure has more than doubled from 4.5% in 2012 to 11.2% in 2020. And it would be really interesting to explore the reasons for this jump in extended breastfeeding in more detail. I do wonder if the input from the community and voluntary sector, including online support, has had an impact on this increase. As a society emerging from conflict, we in Northern Ireland have not yet got our own house in order in relation to the health and well-being of the population. We continue to have some of the worst health outcomes, including for mental health, compared to other European countries. We currently have no functioning government, and our health services, as well as other public services, are struggling to cope on restricted budgets. In relation to breastfeeding as a public health issue, we've had no regional lead for breastfeeding in Northern Ireland for the past couple of years, and we have not had an infant feeding survey since 2010. Midwifery staffing shortages have certainly impacted on the availability and consistency of breastfeeding support given out in our hospitals, and there is a growing reliance on unpaid peer supporters to provide this vital service to mums and their newborns. So as well as having a bottle feeding culture in Northern Ireland, we also have a culture of formula top-ups being recommended in hospitals, particularly by consultants. So as you can see, breastfeeding is not really on the agenda here. The third issue that motivates me is the predatory marketing of breast milk substitutes, which is undermining breastfeeding in our country and around the world. I live on an island where there are 1.5 million cows. This was a deliberate decision by the government in the Republic of Ireland to increase the dairy herd despite carbon emissions in order to supply infant feeding products in a global industry that is worth around 75 billion per annum. Northern Ireland is part of this industry with millions of litres of milk crossing the border between Northern Ireland and the Republic of Ireland every year. It is no coincidence that the Republic of Ireland, along with Northern Ireland, have the lowest breastfeeding rates in the world, because the priority for government has been on investing in the infant formula industry with huge government grants and subsidies. So I personally have been involved in relation to the development of maternity and breastfeeding strategies. Northern Ireland currently doesn't have an up-to-date maternity strategy, and the 10-year-old breastfeeding strategy that we have has been extended by another year. Fortunately, a review of the current breastfeeding strategy is underway, and I've been advocating for the next strategy to be more woman-centred and more inclusive of women's voices. My interest in breastfeeding led me to undertake a PhD into women's use of the internet for breastfeeding support, and I produced evidence that women are looking for emotional as much as informational support. They're looking for a wide range of support at various stages of their breastfeeding journeys, and that many women are keen to repay the support that they've received from others. This phenomenon is known as indirect reciprocity, and it's an indication of the innate potential for our communities to reclaim breastfeeding as a valuable skill, and for there to be more of a social model of breastfeeding support rather than our currently mainly medical model. I am an administrator on Code Monitoring Northern Ireland, which is now a member of Baby Feeding Law Group UK, and we also have very close links with Baby Feeding Law Group Ireland as we share many common challenges. I'm also engaged in initiatives to support a more community-led approach to breastfeeding, including the establishment of North West BAPS project in the Derry City and Strabane District Council area, which, as you mentioned, have the lowest breastfeeding rates in the world. This parent-led project is supported by the council, and it's organic in the way that it's evolving through the ideas and efforts of parents, often in collaboration with local providers of breastfeeding support. In relation to my own experiences, research and observations over the past 30 years, there's 3 key actions that I think would make a big difference to make breastfeeding support more accessible to women who want to breastfeed here. Firstly, I think there needs to be more collaboration between all the groups who are involved in breastfeeding, in the breastfeeding arena. There's a huge range of groups, including health providers, La Leche League, the Sure Starts, Cuidu, the Breastfeeding in Northern Ireland Facebook group, and lobby groups such as Banya Bahar and Breastable, as well as academics and advocates who are all working in their own ways to support breastfeeding here. Currently, some of these groups have adopted an adversarial role towards each other, often vying for small pots of money. Claire Alcott and myself have contacted the chief medical officers in both the North and the South, and we've proposed an all-island platform for infant and young child feeding, which would involve all groups and advocates, including parents, to become more strategic in addressing how to deal with our low breastfeeding rates together. Secondly, I think there needs to be investment. Value needs to be shown towards breastfeeding and breast milk. Keith Hansen from the World Health Organization has said that breastfeeding is one of the best investments that a country can make. We need proper investment in breastfeeding support. It's great that all hospitals in Northern Ireland have baby-friendly initiative status, and this provides a good baseline for basic training, but some women need more support, more skilled and specialised support, which can be difficult to access. Northern Ireland is also home to the only human milk bank in Ireland. This is a hidden gem which needs investment so it can fully meet the needs of all vulnerable and sick babies, and also potentially be the source of milk for mothers whose milk has not yet come in, which would cut down on the amount of top-ups, formula top-ups that are given out in our hospitals. We also need more investment in breastfeeding research, particularly voices of mothers, and I would love to see the development of a breastfeeding institute here in Derry, which could be a catalyst to turn our breastfeeding rates around. Thirdly, I think there needs to be the full implementation of the International Code of Marketing. All countries except the US signed up to this in 1981, but it has not been fully adopted into law in the UK and Ireland. Instead, we have very weak laws that enable marketing of products such as follow-on formula, bottles and teats. And we also still have situations where medical staff are receiving training by the formula industry, and subsequently some medical staff are recommending top-ups instead of breast milk or donor milk in our hospitals. The online marketing of all products, including first milks, is relentless. It is only recently through the work of Baby Feeding Law Group Ireland that there's been some efforts by the Irish government to address the exploitative marketing of formula products in Ireland. There's also been some positive development in the form of an all-island infant and young child feeding and emergencies plan, which is great to see. Countries that more fully adopt the code have a 20% increase in breastfeeding rates. An offer was made at the recent Code Congress in Geneva from the WHO and from UNICEF that they're willing to help countries to more fully implement and monitor the code. I would love to see Ireland, North and South, taking up this offer. Thank you. I'm now going to pass over to Noella.
Noella, you're on mute.
Sorry. Hi. I was just thanking you, Ernestine, and your team for starting the campaign and for inviting us here today and giving us the opportunity to speak. As she said, I'm Noella, and I am a volunteer with North West BAPS, which stands for Breastfeeding and Perinatal Support, in case anyone missed that. So I am currently a stay-at-home mum to 2 girls. They're 5 and 2. And I suppose my motivation to get involved with BAPS was due to my own personal experience. Like I'm sure a lot of us, that's been, our motivation. Following the birth of my second child, my mental health was severely impacted, and come towards the end of my maternity leave, I just wasn't ready to go back to work. And, breastfeeding was really instrumental in my recovery, and I knew going back at that time, it would have been detrimental for both me and my children. So I requested a career break from my employer, and unfortunately it was just flat out denied. And I was shocked to learn that, employers don't have a legal obligation to have a career break policy. And if you want to file any complaints about that in regards to discrimination, you only have 3 months to do so. And that was something at the time I just didn't have the mental capacity for. So I had to make that difficult decision to resign, put, you know, my health, my mental health, and of course my children's health first, to do that. So that left me in a very, you know, low place, I suppose. But, you know, the support I'd received for you know, not to breastfeed, but the psychosocial support I received via breastfeeding from groups like the Leche League. It also brought me in touch with Carol Smith, who's now a CBT therapist, who like helped me greatly through the free services they offered. You know, that made me become very conscious of the fact that I had kind of stumbled across this support via breastfeeding, and it just made me really aware that other mothers, you know, might not be able to find this, because when I was looking for help after moving home to Derry from Antrim, I had to look really, really hard to find it. And suppose that was, you know, the motivation in what I now do with North West BAPS, which is signposting every week to what's on, where it's on, and who you can contact. So I post those weekly updates on our page for local support in the Northwest area. And another thing that kind of motivated me was moving home. My daughter was just coming up too, and I felt a bit more self-conscious feeding in public than what I did when I was living in Antrim. My child was older and people here knew me, whereas nobody else knew me in Antrim. So, you know, I thought, if I feel self-conscious, how is other mums feeling? So I started a walking group to give other breastfeeding mums the opportunity to come along and feed with someone who was comfortable with them doing it, because normally, you know, our normal supports may not be used to breastfeeding. They may not be comfortable with us breastfeeding in front of them at home, let alone in public. So that was an area I also wanted to address. And of course, we also like to celebrate breastfeeding at any opportunity we can. So to date, since we began, we celebrated World Breastfeeding in Public Day at the Guildhall. We had actually the biggest participation for the big global action, so which was ironic considering we're the place with the lowest numbers. And also recently we celebrated World Breastfeeding Week with a gathering of all the support and services for breastfeeding mummies here in Derry in the Northwest. So we're really doing a lot to try and bring public awareness to breastfeeding and, you know, normalise it so it's more visible, I suppose, going forward. But I would like to see things that I think would really help improve our breastfeeding numbers is to provide better support postnatally for mums. In an ideal world, I would love every mummy to have a postnatal doula for a week, you know, at least when they get home from the hospital. And, you know, people might think it's a bit of a stretch, but, you know, we provide carers for the elderly and the sick. And, you know, why couldn't we do that for mummies as well? Not everybody, we're so isolated now, we're in nuclear families and we're living in areas, a lot of us, like myself, found in Antrim, I didn't have any support, and it makes it so much more difficult, especially when you have multiple children. So mums do need help. Also, I would like to see an uptake in the number of paid roles within services for lactation support. And I know there are some roles now, but I would like those roles to be dedicated and not roles that you could be pulled out of to meet needs in other areas. So, you know, we need more staff who are dedicated for breastfeeding support on and off the wards. And then also, I would like to see a use of the existing resources we have in terms of research and to, like Maria was saying, into breastfeeding. Not only from a public health point of view, but also, you know, more research on breast milk and the impact maybe things have, like our histories, the impact trauma has on a mother's decision to feed her babies. You know, we have a really unique situation here in Northern Ireland based on, you know, our past troubles and the impact they have now in terms of addiction rates things like that, especially here in Derry. You know, the impact that might have on me infant feeding, but I suppose I'm also looking from my own background. I have experience with I have my PhDs in type 2 diabetes, but I also work with clinical chemistry, research and development in a private or a local diagnostics company, and I also have a background in microbiology as well. So I've lots of ideas on areas we can look at, and we do have the resources here. So I would really love to see some funding coming, you know, this way, so we can help contribute to, you know, our really underdeveloped knowledge of breast milk, breastfeeding, and how good it is for everybody. So I'll pass you on now to Adele. Thank you.
Thanks, Noella. Hi everyone, I'm Adele Payton and I live in the west of Northern Ireland. I am a mum of 3 boys and I'm a breastfeeding counsellor with La Leche League. About 10 years ago, I set up the Facebook group Breastfeeding in Northern Ireland, and we now have around 14,000 members. And I think through that space, it gave me a great insight into the daily challenges that parents in Northern Ireland face, specific to maybe being in a culture where breastfeeding rates are quite low, and also specific difficulties in areas. So there are pockets where there may be, you know, good support, and then there can be pockets where it's not so good. And also just more of an insight into how people access support and information, and also just the fact that it is another platform for support. So I keep thinking about all the different ways that people access support and need support. So that's one of the things that I'm involved in. The other thing then that I am involved in, I'm a breastfeeding counsellor with La Leche League, and so I run monthly coffee mornings here in Enniskillen, and part of that motivation is providing a space for people to get out and about in the community with other mums who are breastfeeding, and like Noella said, someone who supports that and someone who's totally comfortable with that, to be a bit more out and about, to be seen. It's part of that, you know, infiltrating general society with breastfeeding families, so it's seen. I think part of us growing up in a culture where breastfeeding isn't visible is that it doesn't seem possible to people. So many of the mums I support don't know anyone, like Maria mentioned, no one in their family that they've never known anyone maybe to breastfeed, or people who have wanted to breastfeed but not got the support they needed and unfortunately stopped before they wanted to. So just seeing somebody breastfeeding and knowing someone who is breastfeeding can be a real motivating factor, and just the hope that this can work. It does work for people. So I'm also involved in my daily work. So I work for Sure Start, and why I like doing that role is because that's another area that I think is important, is the continuity of care. So building a relationship, I can build relationships with parents before the baby arrives. So I'll start to drip feed information about normal infant behaviour, about things that help in the early days, about rallying the support and signposting support that's around them. But importantly, just that they will get to know me a little bit and feel comfortable with me, so that when they do need some information or feel like they are struggling, I hope that that makes it easier for them to just drop a text, because we've been developing that relationship. And from talking to lots of parents over the years, the person they usually ask for help first is their partner. And after that, it's a sister, a friend, a mum, but often those people don't have the information. So start with antenatal, build the relationship, and then I can provide whatever support they need. I can do face-to-face, I can meet them at home, I can meet them in the centre if that's better, I can do online and phone. So I'm trying to provide the support in lots of different ways that make it accessible to everyone. And also, importantly, starting to build a relationship with dads antenatally, because the dads that I speak to talk about how they didn't know how to help, they didn't know what to do, they felt helpless, and they really wanted to be a support. And that's often a time where bottle feeding comes into thinking, my partner's really struggling, I don't know what else to do. And in their head is that image from they've been a child of dads and bottle feeding, and you're probably all familiar with the adverts that will perpetuate that as well. So I think that's another that's another reason why I enjoy the role there. So I'm just going to move on then and think about what I would like to see, and I've kind of touched on that a little bit in what I'm doing. I think, you know, we all can see that our society isn't one where breastfeeding is normalized or particularly celebrated, and people don't see it. And I think, you know, potentially we need to kind of fake it till we make it. I think actually having breastfeeding more visible in society and almost desensitizing people to the image of a child at a breast or a child being comforted at breast, potentially in like billboards, in advertising campaigns, and that they are child friendly, because we know that our children start to make those decisions about what adults do when they're very small. So within storybooks, within books, within our curriculums, added into school systems, and when, you know, children or teenagers are doing GCSE biology, many and most of our children are doing that it's just a follow-on of our biology. You know, babies are born and they come to the breast, and, you know, a little bit about how this works, that it's a follow-on, that it's not just babies born and then full stop. And like Maria said, you know, with this passion for, you know, STEM and science within our schools, that all of the students there are having this information about this absolutely amazing natural resource that, as Ernestine had said, you know, is free, and it has, you know, no impact on the environment virtually. So all of those things are really relevant, and really children find it fascinating. So I think there needs to be more of that, and more of the celebration of it. I think we do need support for those families who have, you know, wanted to breastfeed and stopped before they wanted to. There's a huge percentage of people in that category, and there's a huge amount of hurt and trauma there. And I think part of, for those of us involved in breastfeeding information and support, it's a really difficult path to work, trying to hold space and respect for those people, but also celebrate and promote breastfeeding. And I do think from a health agency, health promotion perspective, I think it's time we step up on that and say, we know that's really difficult and we know you're hurting. And also we can also tell the truth about the reality of what breastfeeding and breast milk does for our generations. And that's important. And we can't just ignore that or shy away from it because, because people are sad or hurt. I think hold space for them, be there for them, but also we need to tell the truth and the reality of it. I think, the others have touched on some of the other things I was talking about, like the promotion of artificial milks, and that's been discussed, and I think it's been shown in other countries that makes a massive difference. Then I think as well, which we'll go on to discuss more, is that adding into those teams of support someone who will be there to just sit with mums in that early period, just be there and just hold that space and be able to spend time with them and just reassure them. It doesn't have to be hugely clinical or anything magical like that. Just someone who's adept at holding space and being there for mums. So I am going to pass over now to Sinead. Thanks, everyone.
Thank you, Adele. Thanks, Ernestine, for having us on, and hello, everybody. My name's Sinead O'Kane, and I am a mum of two. and I have baby number 3 on the way. So I'm just about to start my breastfeeding journey all over again, which I'm really excited about. What motivated me to become involved in this was just my own personal journey as well. My first child is 10 and my daughter's 17 months, so there's a massive gap in between the two, and I didn't breastfeed my son. When I was at the hospital, I thought I'll try and just see how I get on, but I didn't do it. It was too busy. I hadn't got a clue what I was doing. He was crying. I was conscious of all the other babies in the ward not crying, so I just put him on a bottle and just forgot all about it, and always said things like, oh, I tried it and it didn't work out. And I would imagine that's kind of what a lot of people would say. Maybe that's their story. But when it came to having my daughter, obviously I was 9 years older, and I really wanted again to see how I would get on with that. So I tried to prepare myself a bit more and went to some antenatal breastfeeding classes. But I went to 2, and although I went to those classes, it kind of went in one ear out the other. For me, the sort of person I am, I needed a baby to be put on me there and then, to be told what to do prior. It didn't work, just didn't work for me, but I was trying to prepare myself. Then when she came, we stayed in the hospital for 2 nights because it was recommended for breastfeeding support. But to be honest, I don't really feel that I got the support that I needed in the hospital for those 2 nights. I was getting support from maybe the healthcare assistants, and this was around the time when it was COVID guidelines still, so my partner could only visit me for 1 hour per day. So we were staying there for 2 days to establish breastfeeding, and I just wasn't really getting what I needed help-wise. I needed someone to have the time to sit with me and for a full feed and say, she's done it, she's fed now, she's happy now. And then actually maybe still be there, and whenever she was crying again, to say, just put her on again, or try this position or that position. That's what I felt I needed, which I didn't get in the hospital. I know obviously the hospitals are so stretched, you can't expect that. But even if my partner possibly was allowed in for longer, maybe he could have tried to support me in that way, but it just took away maybe his bonding for the first 48 hours, and it was just not really useful, that support. So when we got home then on the day 3, the support that I received was the hands-on support that I needed was from a Sure Start worker, as Adele is. It's Catherine from my local Sure Start area. She came down and she sat and she just reassured me and said to me, that's okay, that what she's doing is normal, and try this position, try that position. Because although I tried to research it, I didn't have a clue how to put a baby on. I had no idea how to hold her, what position to do, where to sit on the chair. Do I lie back? Do I sit up? Do I roll over? What do I do? So the fact that she was there just reassuring me is just what I needed. But so this was all motivating me, the fact that she was able to do that. I was thinking, well, I can help mums do that, or that's all somebody really wants, is just that little bit of reassurance. But another motivation behind it was that when my daughter was 5 days old, she hadn't followed the weight guide. So we were referred to hospital. We had to spend the night in hospital. I had a pump to give her top-ups every 3 hours on top of feeding. And one of the consultants just said, oh no, you're going to be too tired to do that. And I'm not really sure where else that conversation was going to go, because a tear just fell out of my eye when they said that, because I thought, you're going to try and tell me to give top-ups here, or you're going to tell me it's easier to give my daughter formula, and that's not what I want to do. I obviously don't want to do that because my body's telling me this. So I think it was, I felt as if maybe I was met with a wee bit of criticism from healthcare people that I wanted to feed her, because I also had a midwife tell me that I must be really thran to continue to feed her, and the consultant saying, no, you're going to be too tired to do that. So that was my motivation, because once we got over our little hurdles at the beginning, which wasn't anyway of a hurdle compared to some, we didn't have tongue ties or anything like that, but it was a hurdle for us. But once we got over that, and I experienced the experience of breastfeeding and the bonding and just how beautiful it is and how you feel, and and how easy it was and how natural it was, and it was a parenting tool, and it settled her, and wherever we went, I just had to bring her and I didn't have to think about anything else. So that side of it was just so lovely, which is, I just can't wait for that again. But that's why I was so motivated, was because I thought, why does not everybody do this? This is so lovely. Just come over your little hurdles to begin with, and then this is just fantastic. So sorry, that's what motivated me. What I've been doing now is I am volunteering with BAPS as well. I've met Maria and Noella through the support groups that I've attended, and I've been helping out in a lot of the stuff that we're all doing voluntary. But some of the things that I've done is attended what was called a human library, which was for a group of young people, where they were attending, it was almost like a speed dating idea, where they were attending an event where there was lots of different organizations of people in the room, and they were going around these organizations, and they had like 5 minutes to ask questions. So there might have been people from disabled people, from ethnic minorities, from the gay community, and we had our breastfeeding team there. We were asking lots of questions, and we personally got involved in that because we thought that it was great for young people to come and ask us questions on this, and we were delighted to find that a lot of the fellas were interested, and they were asking the questions. So we've done that. I've done some videos for the Public Health Agency, just talking about my experience. And Adele, you mentioned earlier about like advertisements. So when we did the event recently there for the breastfeeding week, we got a gorgeous banner put up in Derry to advertise this event. We used my daughter, which I was so proud of, but the picture that we used was the gorgeous picture that was a bit of a phenomenon for a while there, of the tree of life, with a breastfeeding baby with the tree of life. So we used that for our advertisement, and we're just delighted with that, weren't we, to get that put up in Derry. So that's the things that I've been involved in. And if I would want some things to change, I think going back to what Adele said, would be for the education side of things, because just for everybody, just I had my daughter was quite unsettled. It turned out that she had like a milk allergy. We didn't know that. Everybody just assumed that she was unsettled because she's a breastfed baby, and it was nothing to do with that at all, to be honest. It was, she has a cow's milk allergy, but that was just the assumption that it's because she was breastfed. And I was met with all the time, constantly met with, just put her on a bottle. Just put her on a bottle, or fed is best. Just put her on a bottle. This isn't about you, this is about her. And actually, just imagine I did put her on a bottle with the cow's milk allergy. People just assume that breastfed babies are hard work, and that needs to change, because it's not helpful, whenever you're dealing with that kind of an issue, and then you're being almost told that you're doing something wrong by feeding her. So I think the education would be perfect, just to change people's perceptions a bit. So that's me. Thank you. I hand over to Mary. Jo.
Thank you. That's great. Thanks very much for the opportunity to speak, and it's been lovely hearing from everyone else. So my name is Mary Jo Chanel, and I'm a midwife and a midwifery educator and a research student. And my interest is in breastfeeding support itself, in the sense of the actual interaction between the provider and the woman, because it's both like a discrete encounter, but also part of an organised service provision. So there's a balance between, getting it right, because when you're providing it as part of a service, you want certain standards. But in breastfeeding support, you need standards without standardization, it should be said, because all women are individuals and we all behave differently, including the supporter. So what motivated my own interest then in this area? I suppose I have both personal and professional motivators. Personally, like a lot of women, I had difficulty breastfeeding my first baby in the early weeks, and I sought out a variety of support from both healthcare and mother-to-mother support organisations. And this I did overcome them with support, but these challenges, but it actually sort of challenged my identity as a midwife, because I felt that I was someone who was meant to know about breastfeeding, and I was kind of proud of my ability to support women prior until I had this real experience of what support might mean. So professionally as a midwife, I was also always interested in the differing degrees of engagement and knowledge about breastfeeding that I could see amongst healthcare professionals, despite them having standardized training. So these interests led to my own research, and I'm currently in the final stages of a PhD, which explores breastfeeding support providers' views of the factors that underpin how they practice here in Northern Ireland, and also then a deep dive into what breastfeeding support means to women here. So what have I been doing? So I undertook 2 separate research studies. For the first, I asked a range of trained breastfeeding support providers, including midwives, health visitors, trained peer supporters, and self-employed IBCLCs, so lactation consultants, and some representation from GP and health visiting. I asked them about the factors that influence or can impact upon how they support women with breastfeeding. And I found evidence that breastfeeding support providers need certain things to develop their breastfeeding know-how or skill set in the round. So in addition to evidence-based training, which is rolled out across maternity units here in Northern Ireland, providers say they simply need continued exposure to and experience with breastfeeding women and other breastfeeding supporters, and that doesn't always happen. So theoretical training is a great foundation and absolutely essential, but providers learn by doing, and importantly, doing with knowledgeable others. So the visibility and access to perceived informal and formal breastfeeding expertise was identified as a key to experiential learning and practice, but those opportunities weren't always available. Providers also need the opportunity to engage with women in repeated encounters. So we know about the benefits of relational continuity for women, but for the actual breastfeeding support provider, if they have repeat encounters with women, then they get feedback on whether their input has been useful or not, what works, what doesn't, and their breastfeeding support develops accordingly. But this only happens in certain models of care that do have this relational continuity. I also find evidence that providers regard quality breastfeeding support as precarious here, despite the current training of healthcare staff and development of certain roles in breastfeeding support within health and social care, which has improved. Still, yet, all participants in my study felt that it was really down to luck whether knowledgeable, compassionate breastfeeding support would be available and accessible in a timely manner in an appropriate format for a woman at a particular time. And this was often due to lack of resources such as staff, but also a lack of breastfeeding capital in the healthcare system, where support for breastfeeding has less priority than other clinical skills. So it echoes what the other panelists have said. Maria talked about the kind of the social versus the medical model. It's true that I find that things like lived experience and breastfeeding qualifications other than those approved of by the healthcare institution were less valued. And there seemed to be a power differential in the breastfeeding support workforce, which is made up of both healthcare professionals and volunteers. And this can be explained by the lack of valuing of breastfeeding and the lack of social understanding of breastfeeding on the whole in our society with its low breastfeeding rates. And this left many providers feeling frustrated about the ability to consistently support breastfeeding women in a meaningful way. On a more cheerful note, there was lots of positivity reported by participants in all types of roles. So they were really pleased to get feedback from women about effective support, and they would talk about receiving, videos of thriving babies and lots of messages of thanks. But they also felt that they were contributing to a societal shift by increasing social understanding and valuing of breastfeeding. And as Sinead has said as well, and Adele, this normalising of breastfeeding and normal baby behaviours, and getting that knowledge out there was very rewarding for participants. They could feel a shift in a family when they helped a mother breastfeed her baby. So in the second study, I explored what breastfeeding support meant to women. So that was quite a deep dive. It was a phenomenology. So you know, it was a really interesting way of exploring something. I wanted to see what breastfeeding support is, because we kind of take for granted what we think it is. So how did women here experience breastfeeding support encounters when they were in fact effective and supportive? Because lots of women were talking about times when the breastfeeding support in fact wasn't very supportive. So when it was there, what did it mean to women? And I find evidence that women experience breastfeeding support as a wise welcome and stepping stones over undercurrents of fear. In my data, women here were beginning breastfeeding with some anxiety or fear about it due to the lack of breastfeeding in our society. However, when a breastfeeding support provider was seen to have wisdom about breastfeeding, and they were able to welcome a woman into this new breastfeeding world with its different behaviours and lifestyle adjustments, women felt supported. A key part of breastfeeding support was continued signposting to a range of support providers, this stepping stones, always knowing there was somewhere else. That was helping women see that there was always support available from people who believed challenges were surmountable and that breastfeeding mattered. So thirdly, what would I like to happen now? What do I think would improve breastfeeding support provision here in Northern Ireland? So firstly, we need more face-to-face postnatal breastfeeding support provision, both in maternity units and in the community, whether that face-to-face encounter involves direct tips and tricks about breastfeeding techniques or just being a presence which women understand as a measuring and confirming of their breastfeeding ability. For a start, I would recommend that the role of the trust peer supporter be expanded to allow face-to-face access to women on the wards in every trust across the region. There are pockets of good practice out there, but it needs to be reimagined and rolled out. Importantly, both technical and emotional support are really important to women, as Adele has said. You know, this being a breastfeeding support provider is being a wise, you know, having wisdom and being familiar with breastfeeding. And when a breastfeeding supporter has that approach, they will know what a woman needs and when, whether it's more of a technical approach or this welcoming to the breastfeeding world approach. But the ability to judge what a woman needs works best when there is some form of connection or relationship with a woman. So a recommendation would be breastfeeding support models with some degree of continuity with women. That would be really helpful. So secondly, as part of the kind of face-to-face support increase which is necessary, I would urge that the breastfeeding workforce be increased with the development of multi-level, multi-sector breastfeeding teams, which has echoed what the others have said. Such teams would be dedicated in terms of protected role and salary and consist of self-selected community and voluntary breastfeeding supporters and healthcare professionals with a range of breastfeeding qualifications. The team would have a public health orientation so that the health professionals could not be redeployed to cover clinical areas. The teams would act as a satellite working between the healthcare and social arena alongside existing staff giving routine support. But having a shared team of the social and the health roles would hopefully minimise, you know, disruptive positionality between the breastfeeding workforce, ensure easy referral to appropriate levels of expertise, because everything would be within the team, and it would all be within an environment of shared values and social understanding of breastfeeding. There's so much already been said about the lack of visibility of breastfeeding and learning about breastfeeding support through seeing it and being with others. It's exactly the same on the flip side. Breastfeeding supporters need to be around breastfeeding. They need to see other supporters support breastfeeding, and they need to share the values of other breastfeeding supporters. So if they were in a team, they would be protected in that shared values instead of feeling isolated amongst a wider kind of workforce. So such a team would be funded to allow sufficient time for providers to appropriately support women, because my data set demonstrated that women experience support when both this technique-based approach and an embodied social understanding of support are present in the encounter, and that requires time. So such a team would require like investment and reorganisation, but a fresh approach to breastfeeding support can offer new ways to progress. So lastly, there needs to be increased education in relation to breastfeeding support for general practitioners. outside of, you know, education about breastfeeding processes, so outside of basic breastfeeding education, which is not much at the minute anyway in the undergraduate medical curriculum, I think what is needed, what my data shows, is that GPs just need more awareness and education about breastfeeding support. They need more awareness of local and national breastfeeding support options that are available to women. And that way, women who present to GPs with breastfeeding challenges, but not breastfeeding pathology, can be signposted to the option of breastfeeding solutions to breastfeeding problems. And this can avoid damaging breastfeeding by jumping to misdiagnosis of babies and medicalisation of normal newborn baby behaviours. So perhaps funding something like a simple QR code or a resource, an easy resource that GPs can just easily say to the woman, look at that, phone those people. That would be really useful for GPs and women, because I think people really, you know, especially health professionals in the main, do really want to support breastfeeding, but if the lack of knowledge about the wider social aspects and the levels of contacts that are available to women is lesser known. So they're my key kind of recommendations, all sort of clustered around some sort of a collaborative public health orientated approach to support involving both the healthcare and the community and voluntary social aspects of breastfeeding supporters, and then also improve signposting for women. So that's me. Thank you for listening.
Thank you very much, Maria. Thank you to all of you. I think I could listen to all of you for a long time, because as you're talking, there's an awful lot I would have loved to unpick from what all of you have said. And I think that something that has come up quite clearly is that all of you have got your own stories. And there's this question I can't help but ask in terms of breastfeeding support and initiatives tend to come a lot more from people who've had their own experiences and they've somehow navigated through those, and they're now thinking about other mothers and thinking about supporting other mothers. And that's why you see we have peer supporters, and there's like Adele here, but what is, I can't help but say this, but what is most annoying is that something like this, which is a national health issue, is left to people to voluntarily pick that up on an unpaid kind of, you're not paid for it, and then you're trying to fit that into your own work that you're doing. That shouldn't be the case. I just want to first of all applaud all of you for the work that you're doing. Thank you for doing it. You're making a difference to moms' lives and experiences out there. But how long are we going to carry on like this without the government really recognizing what this is all about and taking their rightful place and doing the right thing? I'm going to shut up there, but we have a question in the Q&A. And it's from Hazel. Hazel is asking, I would really value thoughts from the panel on why breastfeeding was so badly disrupted in the UK, Northern Ireland and Derry in particular. Any one of you would like to take on this question, please?
I mean, hopefully we've covered it in terms of all of our different perspectives and our ideas around why the figures are so low here. But for me, the influence of the formula industry is absolutely huge, and the commitment of our governments, north and south, to agriculture and the dairy industry and the production of formula has taken precedence over the health of babies and mothers. So for me, that's the key issue, and it sort of explains why there hasn't been investment in breastfeeding support.
Yeah, sorry, I would like to jump on. Oh, sorry, Sinead, go ahead.
I'll just be really quick, but I do think also it's people's perception of breastfed babies and the fact that they're a nightmare. You know, people think they don't sleep, people think they're unsettled and they cry all the time. They just, but that's not the case at all. Like, I've got a cousin whose daughter's 7 weeks younger and she doesn't sleep, but my daughter does. So, you know, it's people's perception. I think there needs to be better education on just on baby behaviour, really. And that would help, I think.
Yeah.
Sorry, Noella.
No, you're okay, Sinead. Absolutely, I agree with you 100%. You know, we don't really understand what normal baby behaviour is, not just from what we grew up with, but from films, TVs, you know, how it's all kind of put across that way. But I suppose looking from Derry, and I suppose our unique experience, why it might be, you know, I met a mum the other day at a different thing, and she saw me breastfeeding my baby, and well, baby, I say she's a toddler now. And, you know, we started talking about it, and she said, well, you know, back in the days, like I think she was referring to the 60s, maybe, even the 70s. She said, we couldn't have done that because after 3 weeks of having a baby, you had to go back to the factory to work because of our history, you know. Through the Troubles, the men couldn't get jobs, the women had to go out and work, and we have the famous shirt factory here in Derry, and that employed a lot of the women here, and they couldn't stay at home. You know, the husbands couldn't get work, or their partners couldn't get work, so they had to go out and work, so they had their babies and had to put them on formula to go out. So, you know, that's still very raw for a lot of women here, a lot of families here, and, you know, it kind of links back into the mental health side of it, the trauma that we've all experienced, the trauma of our land, how that's affecting us now in the present, you know, like through different coping mechanisms of how to deal with that trauma, addictions and things like that, and the impact that may have on a mother's decision to feed. You know, so even looking at my own family history, I can see why, you know, it's so kind of ingrained. But thankfully now there's more knowledge coming about how to deal with those things. There's more support for addiction here, and, you know, going forward, bringing in breastfeeding is, I suppose, a modality that we can use to help women overcome past traumas as well, which is what I found in my experience. Breastfeeding was very healing for me, and without breastfeeding, I dread to think where I would be now. So yes, sorry to ramble on.
Thank you so much. Unfortunately, time is up, and I just want to say, I think the more I have conversations and listen to people talk about breastfeeding, the lack of support and all this, we can see, I can almost say that there is a political aspect to this. If you think about the formula world, how much they're making, what are they paying the government as taxes and so on, plus the fact that still our government, unfortunately, still looks at breastfeeding as a mother's business, a woman's business. That's your business, even though it is not true. I think we can sit here and talk and explore all of this for as long as we can, but unfortunately, time is up for us. I just want to take this time to thank our panelists so much for being here and sharing your experiences. Mary Jo, your research is so interesting. Like, whenever you are happy to share, please do share with me. And oh, look, we've got other panelists, which we forgot. She's just joined us now, and we just want to say hello and nice to meet you. So thank you all for being here. So the recording will be made available as soon as it's ready, hopefully this week. And we have 2 more to go. So next week we'll be looking at the environmental aspects of breastfeeding, and then to finish off with drugs in breast milk. That's our last one. So I just want to say thank you all for being here. Really, really appreciate your time. Thank you. And do enjoy the rest of your day. If you have sunshine, yay, great. If you don't worry, just get a cup of tea. The sun will.
Thanks, Ernestine. That was good fun. Thanks very much. Hopefully the beginning of a good conversation here in Northern Ireland too. So thanks for facilitating.
Absolutely.
Thank you.
Always up for a conversation. Thank you.
Bye.
Thank you.
Bye.
Bye.